C'est ma musique. C'est pas ma musique, c'est la musique que j'aime. C'est la musique de ma ville où j'ai grandi, à Prague, Smetana, Bordeaux. La musique de fleuve qui traverse le pays et le fleuve est la musique qui traverse l'esprit de mes concitoyens. I am so proud to be here. Actually, I'm even proud of what I've seen in the pictures. He looks good, this guy. Yeah, this is extremely special moment in my life to be honored like this by this recognition in Canada. Canada, which was country of my choice. After I finished the medical school, I get out of that place when the research was subjugated to the guy from whom I wanted to learn genetics was obliged to open the windows, open the cages, and let these 45 strains of Drosophila get out, because that was bourgeois science. Genetics was bourgeois science. So I left. But I was happy enough, I was lucky enough to maintain a relationship with my country. I was for a long time the member of the board of council of the Faculty of Medicine. I'm in many associations there, and I have many students from there. My recognition from what we have achieved, and I will tell you in a minute what we have achieved, goes to Charles University in Prague, to my teachers in Prague. My first teachers show me that research and medicine have to go together. And I'm still in big recognition for that things. My first two papers, I was still medical students, so I wanted to do medicine and research, and that was easier to do it in Canada. And my mentor in Canada was CARTaGENE, who was one of the first crowd of the being member of this society, association, whatever, this recognition of great scientists. And he told me that you have to be physician and at the same time researcher. And I thought it was a kind of a difficult job to do it at the same time, but I did it. At that time, French and English didn't speak to each other in Montreal, so I registered as a full-time student at McGill University and full-time students in University of Montreal. And I did my learning of endocrinology and my medical, duty as a PhD student, and I get the both titles at the same time. And then I went to the Nashville. That's a second place I really need the recognition. Vanderbilt University was a really great place. So great place because I was a little bit more physician than scientist. So I was going back to the Vanderbilt every year for 1 month, sabbatical for 15 years. I became a full professor of Vanderbilt University. And you can be extremely efficacious if you do that. We prepared the studies I was planned to do in Nashville beforehand. So we have a paper a year. And my mentor was Grant Liddell and Joe Harman. And they really teach me how to do the scientific components. And I I succeeded to doing the both. I'm glad I still have patience. I am still doing science and I still have grants. And that's my accomplishment in life. To do both, it's not easy, but it's so rewarding. My goal in my life was to be at least sometime in life #1. To seeing the new things, to recognize it. And it happened to me several times in my life. But in the last part of my life, most important are my students. I have 60 or so students from all over the world, and I have a terrific team. But most important agent in this, it's my wife here, Joan Tremblay. I have ideas. I am reasonably solid in ideas where to go, but she helps me to do it. I'm frequently unable to do it, and she helps me to do it. So that's kind of a couple. We have children and grandchildren and things like that, but we also have papers together for last 30 years. It helps, and I'm grateful for it. And what we have succeeded lately to do, and this is my last point, we have a potential to change part of the medicine for the future by personalized medicine. We have succeeded to detect, using clinics and genetics and polygenic risk scores, to predict who is in danger to having a stroke, myocardial infarction, and other complications of diabetes, and prevent it by treatments which exist at present time. And I am so happy about this end of our career that we are really dedicated to it. And I promise my wife and other the officials of CRCHUM and Université de Montréal that I will retire once that tool is available free of the charge to our patients. So we have a possibility to change, because our tool of predicts to prevent is able to decrease hemodialysis by 60%. I started my career in Canada in hemodialysis. It's a nightmare. It's a nightmare. You know, 3 days in hospital, it's a nightmare. It's not a life, and costs $100,000 per patient per year. So we can decrease it. We have a tool to do it, and we have to do to persuade the public health system and all the agencies to help us to do it. We will do it. We succeeded, and this is my promise to you that we will do it. So thank you very much for this honor. I received that honor in recognition to all who helped me in growing in science, and to all the students and especially the research subjects who help us to gain the knowledge of that possibility to predict, to prevent. And this is our goal in the last part of my life, to succeed it and to give it to the patients with diabetes. Thank you very much.